What are the signs of a healthy baby? Your baby should feed regularly, have wet and dirty nappies, they should be warm to touch, have regular breathing, and their colour should remain the same for them. If their temperature goes above 38 degrees Celsius, seek urgent medical advice. There are some important symptoms you need to be able to recognise. You should ring 999 if your baby stops breathing, becomes unresponsive, feels floppy, or if their skin becomes pale, ashen, mottled or blue. Also, if they become rigid, stiff, or make jerky movements that don't stop when you hold them, or they have a rash that doesn't fade when pressed, or if they vomit green fluid. Seek urgent medical advice if your baby's cry changes and becomes very high-pitched or weak. If their breathing changes, such as breathing very fast, or they make a grunting noise with each breath, if they have a bulge in the soft spot on the top of their head, have blood in their poo, if they start vomiting very forcefully, or have no interest in feeding. Jaundice is a common and generally harmless condition that causes yellowing of the skin, whites of the eyes and gums. Your midwife will check your baby for signs of jaundice, but if you have any concerns or you feel the colour change in your baby is not improving, then please contact us on the Maternity Advice Line. If your baby has jaundice and becomes reluctant to feed, sleepy or difficult to wake, has pale poos or very dark coloured wee, then contact us on the Maternity Advice Line. It's important that your baby is seen by a healthcare professional. Regular feeding will help to reduce jaundice levels. Your baby will let you know when they are hungry by becoming restless, sucking their fingers or moving their mouth. Follow your baby's lead and feed them when they are hungry. But, as a rough guide, your baby should feed 8 to 12 times every 24 hours in the first few weeks. You may find it helpful to keep a record of what time your baby wants a feed and if you have needed to change their nappy. Your community midwife can offer advice and support for feeding your baby, however you choose to feed. You can also be referred to our infant feeding support team if needed. You can find out more information from the Trust's infant feeding leaflets. The risks for sudden infant death syndrome or cot death can be reduced significantly with a few simple measures. These include putting your baby to sleep in a separate cot or Moses basket, on a firm, flat mattress in your room for the first 6 months of life. Place your baby on their back with their feet to the bottom of the cot. Avoid any loose bedding or blankets that could ride up over your baby's face. This includes bumpers or soft toys. The ideal room temperature is between 16 to 20 degrees Celsius. On average, your baby needs 1 extra layer than you. Feel your baby's chest or the back of their neck. If they feel hot or clammy, your baby is too hot. Take off a layer. We do not advise you bring your baby into bed with you to sleep, but if you choose to, please ensure you keep your baby away from pillows and make sure they can't fall out or get trapped between the mattress and the wall. Ensure the bedclothes can't cover your baby's head, and don't share with any pets or other children. We particularly recommend you do not bed share with your baby if they were born early or if they had a low birth weight, below 2.5 kilograms or 5.5 pounds, or if you or your partner smoke, have drunk any alcohol, have taken any drugs or medication that can cause drowsiness, or if you are feeling very tired. Never sleep with your baby on a sofa or armchair.